Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking in this segment with Dr. David Henley. He's joining us here as Executive Medical Director, Alzheimer's Disease Global Medical Affairs, Neurology Business Group at Eisai Inc. He's going to share his perspective on some recent advances in Alzheimer's disease research and therapeutic approaches, including the role of the amyloid-beta pathway. Welcome to Health Professional Radio. Dr. David Henley, thank you for joining.
Thanks, Neil. It's great to be here, and I'm excited to talk to your listeners today about a little bit of an update on Alzheimer's disease and the role that amyloid beta plays in the disease, as well as a third key message that I think folks need to understand, which is that the disease, as we learned in the last 10 years or so, the disease is starting, the underlying process is starting 15 to 20 years before you see symptoms. And so it's kind of a sea change for us as clinicians because we've tended to think of this disease as a clinical diagnosis, just when the symptoms this disease starts when the symptoms occur, but it's actually not the case. And so I think listeners need to be aware of that so that they can now take any kind of cognitive complaint sort of seriously when it's presented to them.
Is there a significant difference between Alzheimer's disease specifically and other types of dementia? Are there many types of dementia?
Yes, there are many types of dementia. So dementia really just means that the brain circuits are failing. So it's global brain failure really is what the simple way to think of it. And the types of dementia are really getting at what causes the circuits to fail. So in Alzheimer's disease, we think of amyloid plaques and neurofibrillary tau tangles and other processes that are associated with the accumulation of those two key pathologic hallmarks. Those are what's damaging the brain in Alzheimer's disease. But then there are other types of neurodegenerative, we call them neurodegenerative diseases that lead to dementia. They're such as frontotemporal dementia and others, Lewy body dementia, vascular. There's many of them, as you mentioned. But Alzheimer's is the most common. 60 to 80% of dementias are related to Alzheimer's disease.
You mentioned that it onsets long before, maybe 20 years or more before you actually see symptoms. Are there biomarkers for Alzheimer's?
Yeah, that's one of the exciting things I wanted to share with listeners today is that in the last, I would say 10 years or so, we historically, Dr. Alois Alzheimer, he had to do an autopsy to identify the plaques and tangles in the brain of the first patient that was identified with Alzheimer's disease. And just until 10 years ago, that's what we had to do. We had to make a clinical diagnosis and then wait to see what happens, clinically to see the progression of the disease. And then ultimately, when the person would pass away, the only way to make a definitive diagnosis that, yes, in fact, their dementia was due to Alzheimer's was to do an autopsy of the brain and look at it under a microscope and see if we could if we could see amyloid plaques or neurofibrillary tangles. Now, in the last 10 years or so, we have this ability to measure plaques and tangles in people that are alive, which is really exciting.
Now, I understand there was a recent announcement around lecanemab. What does that mean for the Alzheimer's disease treatment?
Well, Neil, there are several. So amyloid beta, we haven't gotten into it much yet. We talked about the plaques, and there are several. For the last 10 or 15 years, actually, my whole career in pharma, the primary target for therapies to slow the progression of Alzheimer's disease has been anti-amyloid therapies. And you can do this in different ways. You can target the plaque or you can target, soluble species of amyloid, but we haven't had a lot of success, which has been unfortunate. Some of that has been learning how to do the trials, what types of patients should be in them. And then also now that we have these biomarkers, we're able to select the patients that have the pathology that you're targeting, which seems kind of obvious that you would need to do that, but we weren't able to do that before. Now we are. So there are a group of anti-amyloid therapies. There have been a group of them that have been in development, but recently there have been there's been some breakthroughs, and I think that's very exciting for people to understand. We have a ways to go, and of course, the science is never easy. When you're making breakthroughs, it's dirty. It's not super obvious, not super clean. Usually, you don't come. As you know, and your listeners know, usually you don't have a scientific breakthrough that just cures a disease right out of the gate. That's exciting when it happens, but it's very rare. So we have to learn as we go, and the signals you have to look for the signals in the data, and I think that's where we are now is trying to understand what we've seen so far.
Can you talk about some of the journal Molecular Psychiatry entries? Yeah,
absolutely. So one of our key opinion leaders that is helping us here at Eisai, his name is Dr. Harold Hampel. Many of you will know him or have heard his name. He's one of the top publishers in Alzheimer's disease, in the field of Alzheimer's disease. And we're really excited that he just published an article together with some colleagues that is a systematic and cross-disciplinary state-of-the-art update on the genetic, epigenetic, and biological data that support the pathophysiologic role of amyloid-beta in Alzheimer's disease. And we'd like to highlight, I guess, that the article includes the world's foremost experts in amyloid-beta science. These are all the top people that some of whom actually had postulated the amyloid hypothesis in the beginning. And so we put this into this paper as a controversy-free, consensus-reaching assessment of the available evidence. And, it really delves deeply into the amyloid beta pathway, as well as the other downstream pathophysiologic processes of Alzheimer's disease, such as tauopathy and neuroinflammation, changes in various neurochemical systems and alterations of neural networks in the brain. So it's a very interesting read and very comprehensive. And I think it's going to move us forward towards more of a biomarker-guided, pathway-based therapies, and ultimately maybe combination therapies as we understand more about the various pathologies in Alzheimer's disease. So I think the way I think of this is that we're approaching a precision medicine model with Alzheimer's disease, which is in neurology, has not been very accessible to us. In oncology, they've made great strides with precision medicine, but we've been a little behind in neurology, and I'm pretty excited that we're getting there.
Was there anything else that you'd like to add for our listeners before we get a website where we can learn more?
I wanted to make sure that people understood that amyloid beta does play a real pivotal role in this disease, and it starts to accumulate 15 to 20 years before the symptoms. So there's a whole cascade of events that go on as part of that. So this preclinical phase, we're studying that now, but there's not going to be a treatment for that for quite some time. So in lieu of that, I think the key is that as soon as you see symptoms, then maybe you should be screening more for cognitive symptoms, cognitive impairment as people age, because you want to try to pick up the disease as soon as they develop the symptoms, so you can save as much brain as possible with any new treatments that we were able to bring to the market.
Well, if you would give us a website where our listeners can learn more about Eisai.
Yeah, sure, Neil. So you can go to us.eisai, and that's EISAI.com, to learn more about the neurology portfolio at Eisai. And that should take you to, we could see some various pipeline, for example, of what we're researching and other very informative articles and such.
Well, David, I appreciate you giving us this information, joining us here on the program this morning. Thank you so much for your time.
Okay, thank you so much, Neil, and I appreciate all the listeners' attention.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. David Henley. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.